for our next discussion before we proceed to the anxiety disorder. So when you talk about anxiety, guys, anxiety is defined by the book as a stage of uneasiness or discomfort experienced to varying degrees, frequently coupled with doubts, fears, and obsession. In other books, anxiety is defined as the fear of the unknown. Yun yung pinaka-common na definition na alam natin based on the book. The fear of the unknown. But based on the book of Billy Beck, anxiety is the stage of uneasiness or discomfort experienced to varying degrees, frequently coupled with doubts, fears, and obsession. So that is your anxiety. Now, anxiety itself is not psychotic by nature. Okay? Hindi po siya psychotic. And your anxiety is a common thing that happens to a person. Lalo pag nasa crisis state po tayo. Okay? And commonly, this anxiety is being resolved by the body or by the person by using now your coping mechanism skills. And as I mentioned during our first time na discuss tayo ng psychiatric nursing, problems occurs when we use this coping mechanism skills is not effective. It started already to affect our activities of daily living. So ang coping mechanism ay normal na ginagawa natin, and nagiging problema ang coping mechanism kapag paulit-ulit siyang ginagamit, and it already affected our activities of daily living. Okay, because of anxiety. And anxiety may lead to disorders that is commonly coupled with doubts, fears, and your obsession. Doubts, fears, and obsession. Kung sinabi natin doubt, ay yung mga paranoia. We have your fears, we have your phobia, and of course, obsession, your obsessive-compulsive disorder. Okay? So let's talk about what is anxiety and what are the levels of anxiety. So there are 4 levels of anxieties as I described earlier, but to further the discussion, okay, let's go into details in terms of these levels of anxiety. So the first level, again, we have 4 levels, level 1, 2, 3, and 4. The first level is your level 1. Level 1 or your mild level of anxiety. This level of anxiety, a person is considered as alert and awake. Right now, you are considered alert and awake. And you are focused on our discussion. And of course, yung iba siguro sa inyo, there is no anxiety at all. But some of you are anxious because you are thinking that you need to prepare for your board exam. Isn't it? Yes. And that's a good level of anxiety. You are focused. You are alert. Kasi kapag mild level of anxiety, a person is considered to be heightenedly aware of what is happening in the surroundings. That's why when I asked you what date is today, you have to answer that correctly. Asan ka ngayon, you have to answer that correctly. It means to say that you are alert and you know and aware what is happening. There is an increased perceptual field. Pag sinabing increased perceptual field, kahit yung mga bagay na nasa side ko, nakikita ko. Hindi ako nakafocus lang kung anong nasa harap ko. Okay? There is also a sharpening of the mind. No? Nakakatalino daw po ang mild level of anxiety. That is why when you take your board exam later on, or any type of exam, you have to have that feeling na kinakabahan ka. Kasi kung hindi mo nararamdaman yun, may problema din. Okay? Kasi what you're going to take later on, your board exam, is a challenge. And whenever you are into a challenge, you have to have at least feel a mild level of anxiety for you to be more focused. Because once you are in a mild level of anxiety, your perceptual field will be wider and you will become focused and motivated. Focused and motivated. Kaya sabi nila, a little pressure is a good what? Pressure. Okay, is a good motivator. Tama? A little pressure is a good motivator. Kailangan kasi minsan pressure din tayo para gawin natin. Ngayon, kasi kung walang nag-pressure sa atin, walang nag-push sa atin, sometimes we will become relax lang and will not do anything to improve ourselves. Okay? But as I mentioned, it is not normal na lagi tayong binabagabag. Whatever the level is. That is why, even though this is a mild level of anxiety, we still need to what? Manage this condition. And the best way to manage this condition is to encourage the patient for verbalization. Okay. So okay, kahit maganda ang resulta ng exams mo, kailangan kinakamusta ka pa rin. Okay? Kahit maganda ang resulta ng mga review mo, kailangan kinakamusta ka pa rin. Okay? Even if you are graduating your course with flying colors, still sometimes you have to have a top in the back. O kamusta ka na? Okay? Because that's a good thing. It means it will keep you always aware of what is happening and where you are right now. Okay? Kaya may track ka nun. Now, this condition might proceed to a further level of anxiety if not managed correctly. For example, okay, encourage verbalization, walang kumausap sa'yo. Then the pressure boils down, hanggang sa bumibigat. Until such time that your level of anxiety increases now to your second one, which is your moderate level of anxiety. Ano naman pong ibig sabihin ng moderate level of anxiety? Moderate level of anxiety, okay, you will observe this to the person with purposeless pacing. So yung purposeless pacing, alam niyo, hindi mapakali. Yan. Lakad ng lakad. Okay? Yan. So hindi mapakali, lakad ng lakad. And kadalasan, kung ano lang yung nasa harap nila, yun na lang yung nakikita. Paano yung kadalasan nito? Anong signs nito? Ito yung nagre-review, tapos kinakausap mo, hindi ka pala naririnig. Kasi kahit nagre-review ka, sometimes you are still what? Aware of your surroundings. Baka naman nagre-review ka, mapupukuran ka yan, di balay mo, kasi yung pala naka-focus. Because your focus is narrowed down to what is you're doing in front of you. So yung other things na nangyari sa paligid mo, hindi ka aware. Ibig sabihin, you are not alert. Are we clear? So that's a good indication. That's actually a sign. So nagre-review kang ganyan, kinakausap ka ng friend mo, uy, nakikinig ka ba? Ano dyan? Yung nakapokus na sa ginagawa mo. That's a moderate level of anxiety. So, kasi nga nagkakaroon ka ng selective attention. Selective attention. Okay? So, there is a sudden changes in the vital signs. Kadalasan, the signs are sympathomimetic. Okay, when you say sympathomimetic, vital signs increases. Okay? And the patient will become diaphoretic. Nagpapawisan. Okay? Muscle stiffness and nagkakaroon ng GI disturbance o yung tinatawag nating butterfly in the stomach. Though both of these, though butterfly in the stomach can happen in both mild and moderate, but this is more evident sa inyong moderate level of anxiety. So ito yung, pumunta ka na lang stage, o kaya malapit ka na, bigla kang maiihi, bigla kang parang matatain. Nasa nyo na ba yun? Yung bang parang kang natatain, parang kang naiihi, nung pumunta ka naman ng CR, ang konti na lumabas. Natry nyo na ba yun? Yung parang tumulo lang, di ba? Parang sa mga lalaki na magkaroon ng dribbling. Sa babae, kas nakalangkwangay, kas nakalang sa armpiti. Ano sa armpiti? Yung pag umupo ka na matagal sa mainit, parang gano'n, na semento. So that is actually your GI disturbances. If you are feeling that already, tapos kinakausap ka, pero focus na focus ka, wala ka naririnig na iba, you might be already on a moderate level of anxiety. And since this is a higher level of anxiety na compared to level 1, again, we need to manage this. Okay? We need to manage this. Okay, question. Can the patient or a person still verbalize their feelings if they're on your level of anxiety? Yes. But the thing is, compared dun sa una, they need assistance. Okay, they need assistance. So tell me more what you are thinking. Okay? Ano ang nasa isip mo kanina nung kinakausap kita? Parang hindi mo ako napapakinggan. Okay? So those are the things, verbalization feelings. And since this is a high level of anxiety, the physician might order a PRN drugs or as needed drugs of drugs which is your anti-anxiety or your anxiolytics. And of course, continue encouraging the patient or a person to verbalize their feelings. Are we clear? Yes. So compare natin. Mild, moderate. Sino yung good? Mild. Sino yung not so good? Moderate. Sino yung may continuous purposeless spacing? Moderate. Sino yung may widened perception? Selective attention? Moderate. More prominent ang GI disturbances? Bibigyan ng PRN anxiolytics? Moderate. More on in verbalization of feelings lang. Are we clear? Yes. Should we also verbalize feeling to moderate? Yes. But the medication would still be needed also. Okay, as a PRN meds. Okay, PRN meds. Now, kapag hindi na naman ito na-manage at hindi na-control ng mild level of anxiety, I mean ng mild tranquilizers, which is anxiolytics, it may lead to a higher level of anxiety, which is now the level 3, known as your severe. Okay? Severe level of anxiety. Ano na po ang severe level of anxiety? Kung kanina is nakafocus naman, kaso selective lang. One is in my front, okay? Nagkakaroon sila na kung ano nasa harap ko, yun lang ang gagawin ko. Okay, parang wala akong narinig. Or other senses are being or are already not alert. Okay? Sa severe naman, there is an increased continuous pacing. Kung kanina purposeless lang, eto mas lalo siya ng bumibilis. Tumatakbo na, okay, kung ano iniisip, kung ano ginagawa sa kamay, okay? Does not know what to say or do, and limited perceptual field. Cases dito, nagkakaroon siya ng tunnel vision. Okay, tunnel vision, yung talagang focus na, yung ba tipong wala na nakikita talaga. May iba, kundi yung nasa harap lang. Nakalock in na yung kanyang isip so kung ano yung problema or yung nagkukos ng stress sa kanya. Okay? So, nagkakaroon na tayo ng visual disturbances, tunnel vision, and tunnel vision. Okay, in terms of your ENT, eyes, nose, throat condition, anong sakit ang may tunnel vision? Glaucoma, very good. Sino yung may curtain vision, curtain rod vision naman? Ay, glaucoma. So, I'm sorry. Sino yung may tunnel vision? Yung ganyan, o? Glaucoma ba? Oh, glaucoma, tama. Sino naman yung may curtain-like vision? Sino naman yung merong peripheral vision? Cataract. So, tunnel, glaucoma, curtain-like, retinal detachment. So, yung ganyan naman, yung, yan, ang nakikita niya yung peripheral field vision, cataract. Kasi yung cataract is clouding of the cornea. Natatakpan nyo na naman. So, more or less yung gilid lang ng cornea ang malinaw, kaya yung perception niya is more on peripheral field vision. Are we clear? Are we clear? Sino ulit yung curtain light? Retinal detachment. Sino yung may tunnel vision? Glaucoma. Sino yung may peripheral vision? Cataract. Are we clear? Yes. Okay? So, patient will become nauseated and sometimes will feel chest pain also. Chest pain. Nauseated and vomiting, tapos nakaramdam din siya ng chest pain, and there is a stimulation of your fight and flight response. So, pwede ba itong biglang tumakbo? Yes. Ito yung mga biglang nadidisgrasya kasi biglang tumatalon. So, anong priority mo dito? Airway or safety? Safety. So, ano ang application natin doon? Pwede i-apply ang management na SSS. Yes. Ano yung SSS natin? Safety and security. Stay with the patient. Promote safety, okay? Kasi risk for fall po ito, risk for injury, risk for committing self-harm, okay? Then will not verbalize feelings with directive approach, okay? So they will not verbalize the feelings, that's why as a nurse, you have to do a directive approach. So you say directive approach, it has to be simple and concise, okay? Pag sinabi mo, Pedro, sit down, mupo ka. Hindi yan, ganito kasi yan. Dapat kasi ang gagawin mo. There's no more explanation. Be directive with your instructions. It has to be simple and concise para masadali niyang maintindihan. Okay? So, sit down, stay in your seat. Okay? Or stay in your chair. Sit down, stay in your seat. Okay? And the management, since hindi na siya makapag-verbalize ng feelings, ano ang gagawin natin? You have to be very, be directive in a calm manner. So, sabi ko, stop running, sit down, stay in your chair. You have to be simple and concise, direct. Okay, direct ka sasabihin mo. Okay? Use plain and simple instructions. And of course, decrease environmental stimuli. So, decrease environmental stimuli. And since ang patient natin, pwedeng magtinatakbo, makatalon, makadisgrasya, at madisgrasya, The promotion of safety is very important. So, anong priority mo? Airway or safety? Safety. O, safety. Sabi na daw. Safety. Okay? So, decrease environmental stimuli. So, pag sinabing decrease environmental stimuli, nagsisevere anxiety ang pasyente, magpapatugtog ka ba ng rock music? Kapilin dan ko lang doon. Lola! Lalo mo ma-stimulate yung ating pasyente. So, pwede ka magkuhan dito, music therapy, pwede ka mag-play ng calm music. Yung mga calm music natin. Ano yung calm music namin? Yung mga canon D. Ano yung canon D? Kaya, canon D. Wag naman yung kuha niyo parang lead me Lord ko lang to. Wag yung mga religious songs. Hindi pwede. Okay? Hindi pwede mga religious songs. Okay? Next, kapag hindi na-manage ang condition na to, it may go out to the last stage of your anxiety, which is your panic level of anxiety. So, panic level of anxiety tayo. So, panic anxiety, dito na nagkakaroon siya ng loss of rational thinking. Hindi mo na talaga makausap ng maayos. And possible the patient may develop delusions and he will be on a hysterical stage and completely block mental process. Completely block mental process. So, you will not be, you cannot talk to this person already, okay, nang maayos. Because they are already on a state that you will consider them as block. Okay? So, natutulala na lang po sila. Okay? You cannot talk to them. They can't be reasoned out. Hindi mo sila ma-reason out. Okay? So, muteness and personality disintegration. Okay? That may also lead to shock and deepen hyperventilation and physical exhaustion. Yung pala, pag nagkaroon ng pasyente natin, pag nagpapanik na siya, nagkakaroon na ng hyperventilation, what will you do? You manage symptomatically, tama? So manage the symptoms that are present at that moment. So pag nag-hyperventilate siya, you have to manage the hyperventilation. Question, how are you going to manage the hyperventilation? Ano? Brown bag. Wala ka lang talagang brown bag lagi. Ano? Cup hands. Huwag nung sabi ng plastic bag, ano yan? Nag-a-addict. Ano yung rugby? Okay. Of course, pag wala tayong brown bag, you may use your cup hand. But depending yan kung saan yung location. Pag ang nurse o yung pasyente is nasa hospital or malapit sa isang medical facility na available ang oxygen, the best answer is low-flow oxygen. The best answer is low-flow oxygen. Okay? Low-flow oxygen. Pero, kung walang available, kunyari sa community base, of course, the best answer is still brown bag. Pag wala yung brown bag dun sa choice, you may answer cupped hands. Paano yung cupped hand? In-close mo lang. So, the goal there is to retain the carbon dioxide para ipasok sa katawan natin. Tama? So, kung lumalabas ang carbon dioxide natin, pag nag-hyperventilation ng pasyente, ano ang meron siya? Respiratory alkalosis or acidosis? Alkalosis. Because your carbon dioxide is carbonic acid. So kapag nawala ang carbon dioxide sa katawan, kulang ang acid natin. Therefore, mas mataas ang alkaline. Kaya respiratory alkalosis yun. Okay tayo? And to manage that or to reverse that, you have to return the carbon dioxide na lalabas sa katawan natin. And take note, pag naubusan ng carbon dioxide ng katawan, makakalimutan natin huminga. Yes, because carbon dioxide triggers respiration. Without it, hindi tayo hihinga. Clear tayo? Yes. Okay? Yes. Kaya nga, carbon dioxide, if mataas naman sa katawan, it has a sedative effect. Kaya kapag hindi ka masyado nagsasalita, mamaya inaantok ka na. And the body is trying to compensate. How? Through expelling excess carbon dioxide by yawning. Isumagsuyaab ka. Nagets nyo? Yes. Okay? So that is your Panic. So, may commit suicide with no idea of what is he doing, and the management should be protecting the patient from physiologic exhaustion. So you manage the symptoms as it is, okay? And of course, while promoting safety, okay? While promoting safety. So you manage the condition to prevent physiologic exhaustion, okay? Like controlling the hyperventilation, and you have to apply the safety protocol. So SSS, safety and security, ano pa? Stay with the patient or sit with the patient. Okay? Stay or sit with the patient. So that is your panic level of anxiety. Ang pasyente natin, high level na. Pwede ka magbigay ng drugs? Yes. Severe anxiety, pwede mong bigyan ng drugs yon? Yes. Lalo ito, pwede mo nang bigyan. Okay? So priority, safety, and stay with the patient. And drug of choice, ang pasyente natin, though siya po ay anxiety ang nature, but since yung manifestation niya, tignan nyo, muteness personality, which is a negative sign leading now to depression, so pwede ka magbigay ng antidepressant drug. So for your level 2 and level 3, anong bibigay natin? PRN, anxiolytics. Panic disorder or panic attack is already high level of condition. That's why you have to give major tranquilizers. Ano ibibigay natin dito? SSRI, antidepressant, and the best drug of choice is SSRI. Are we clear? Are we clear? Yes. Do you have any questions? Okay, so what are the other concepts of anxiety? So other concepts of anxiety, priority nursing diagnosis for anxiety is your ineffective airway clearance or ineffective coping mechanism or individual coping, and of course anxiety, a standalone nursing diagnosis. And the principle of nursing care in anxiety is you have to be calm, administer prescribed medications depending now on the level of anxiety. Listen to the patient's concern, let them verbalize their feelings, especially for level 1 and level 2. And you have to minimize environmental stimuli, especially for severe level of anxiety. By the way, pag mga ganyan pala, pag panic attack, one thing that you can be severe and panic attack is you have to remove them from the source of stimulus. Okay? So you have to remove them from the area na nagkakos ng kanilang anxiety. Okay? Should you remove the entire nyari, nasa group therapy sila. Sino tatanggalin mo? Ilayo mo yung mga kasama or siya ang alisin mo? Siya. Okay, siya ang alisin mo. And take note, kailangan mo siyang alisin dun sa iba because kapag na-observe din ng iba, pwede tayo magkaroon ng multiple casualty. Pwede ba matrigger yung anxiety ng iba? Yes. Anong condition niya sa site? Yung sinasaniban siya, o may sinasaniban na din. Dysphoria? Dysphoria ba yun? Yung madalas explanation ng mga psychiatric doctors kapag may mga nasasaniban na more than one. Okay? So that is your levels of anxiety. Are we clear? Are we clear? Yes. Do you have any questions? Clarifications? Violent reactions? Again, pag sinabi natin mild, ito ba yung good level of anxiety? Yes. Pag sinabi natin moderate, magbibigay ba tayo ng PRN anxiolytics? Yes. Pag sinabi natin severe, ito ba yung fight and flight? Yes. Muteness naman kapag panic. Nakakaintindihan? Ano ang drug of choice kay panic level of anxiety? SSRI. Are we clear? Yes. Do you have any question? None. Very good.